Physician-assisted suicide has been around since the 1900s, and it's only grown more controversial since then. Physician-assisted suicide, also known as aid in dying, it was always talked about very differently than euthanasia. Euthanasia is the administration of a lethal medication to an incurably suffering patient voluntarily or involuntarily. It's also what physician-assisted suicide is in the terms of text. Euthanasia means good death in Latin, eu meaning good and anasia meaning death. And it's a way to put yourself or another one out of misery. It's a way to give death with dignity. Working in a vet clinic, I've become accustomed to euthanasias, and 9 times out of 10, it's to relieve the suffering out of a patient. And we're able to do that for our loved animals and let them go before the pain starts and before they lose themselves. So why can't we do that for ourselves or our other loved ones? Cancer is one of the main terminal illnesses that there is in the United States and in the whole entire world, and there is no cure for it. In 2025, an estimated of 2,041,910 new cases of cancer will be diagnosed, and 618,120 people will die from that disease. So about 620,000 people will die from the disease when it can be painful and they're forced to suffer until death. Physician-assisted suicide or death should be legal for anyone to use that meet the certain criteria. The first reason is for the relief of suffering. If someone is dying of a terminal illness, why should they have to suffer until death? Does that person not get to choose how and when they die? This helps patients that are terminally ill be able to choose if they want to suffer through the pain and that the rest of their life brings. And when they are terminally ill, they can become on a cocktail of drugs that just make them not there. So mentally they could not be there and physically still be in pain. It also gives respect for patient autonomy. Autonomy is a decision that one will make for their own actions. So in medical terms, this means whether a patient will go through treatment or not. A physician will come in with information about the risk or the benefits of the treatment or a medical intervention, and that information will help a person make a decision to justify their own thoughts about how to proceed with informed consent. And that is autonomy. And it protects their own decision if they choose to pursue medical death. It's also a medical need. So having a physician prescribe a patient death is necessarily a medical need. It offers a safe and organized way to end one's life and ensures that it is done properly. Without this aid, patients may often go and do something to themselves to end their own pain and suffering, where it could be very dangerous to themselves or others surrounding them, such as choosing euthanasia on their own with no help or medical terms, where they could end up in worse shape than they were originally. One opposing argument that one may have would be that patients would abuse this practice when they might not need it. And my rebuttal for that is there are certain regulations put in place and criteria that a patient must meet to even be eligible for assisted death before being considered for it. The Netherlands and Belgium were the first 2 countries to legalize physician-assisted suicide, and with all of the research that was done, it had not been abused by any of the patients. Following the Netherlands and Belgium, many other European countries are now working on legalizing the practice as well. Ireland, France, Cyprus, Slovenia, and Malta are a few European countries that are following. For the criteria in the United States, the patient must be at least 18 years old, be a resident of the state where they wish to die. So Oregon and Vermont are the only 2 states that exempt that residency requirement. They must have a prognosis of 6 months or less to live, and that is to be determined by 2 healthcare providers within the jurisdiction requirements. They must have the mental capacity to consent, and that is determined by the physician. And they must be able to administer a lethal dose without assistance. So if the doctor were to give them that lethal dose, they must be able to use it on themselves without anyone helping them. Currently in the United States, there are only a few states where physician-assisted suicide is legal, which is California, Colorado, Delaware, Washington, D.C., Hawaii, Maine, Montana, New Jersey, New Mexico, Oregon, Vermont, and Washington. There are about 10 states within the next year that may consider legalizing this practice as well. Physician-assisted suicide is becoming more common all around the world, with European countries and more states legalizing it every year. It is a medically necessary procedure that will help put an end to patients' suffering when they have a terminal illness, and that is done safely.